So welcome back, everyone. I am excited about bringing on my next guest, who has been on with me now over 5 years. I have with me Howard Farkash. Howard, you are a professional insurance, you know,
I'm a broker. What I do is I represent many different types of insurances, and I help people select a plan that's right for them, whether it's life insurance, health insurance, Medicare, disability income, long-term care, or to move their money to a safer place and out of the market into an annuity, which for the most part, it's very difficult to lose money on an annuity, basically.
Now, today, I want you to talk a little bit about what you want to talk about today. You have it down to the T, so let's
Well,
go.
I do prepare for these meetings. I'm
Yes,
very happy to.
absolutely.
First of all, let me say good afternoon to our listening audience. It's a pleasure to be here with you.
Thank you.
I came out here years ago, took an early retirement from another industry. I visited my parents. I liked it here and I stayed, so that was pretty exciting to me. My retirement, though, was not exactly my cup of tea, basically. I'm fascinated by insurance and planning for the future. I'm also fascinated by the intersection of health and wealth, so I started my agency in 1998. It's the Howard Farkash Agency, and as I said previously, it affects life insurance, health insurance, Medicare, disability income, long-term care, and annuities. But today I thought we'd discuss something going on in current events. We're going to talk about the big, beautiful bill. Not everybody says it's so big or so beautiful. It is certainly big, that's for sure. But I'm not going to be politic here. I'm just saying this is what we have, this is what we have to live with, and let's get to it, basically. So I'm going to discuss its effect on health insurance. The big, beautiful bill is essentially a budget bill. There are two items of consequence for underage ACA health insurance and Medicaid people who are on Medicaid, which we call access in this state. The first is there's been no provision for extending the COVID era premium tax credit during the past year, and I'll explain that in just a couple of seconds. What this means, though, is premiums will be going up normally, as they do every year, but there'll be lower discounts, which is what the premium tax credit is all about. Those are going away, which means you're going to see some significant increases in your out-of-pocket premium costs, basically, and that's a serious matter. The second major event that's part of the big, beautiful bill is cuts to Medicaid or access as we know it. This means that some people will, or many people will, actually lose their Medicaid coverage, basically. And along with the failure to extend the premium tax credit, that means some people will give up their ACA coverage because they just won't be able to afford the increased premiums, basically. Given all that, the cuts to Medicaid, along with the loss of the premium tax credit, means that rural hospitals are in jeopardy of closing, and that's an economic fact. They live on people who are getting those nice premium tax credits or who are on access, and they're financing their entire economic model is at risk, basically. And we expect, even though a provision was in the big, beautiful bill for some money for these hospitals, it's predicted that money is insufficient to cover what's going to be the off-fall, as we used to say back in manufacturing industry, the off-fall of those hospitals. You will see more people using the ER as their primary care, and you'll find longer waits for care and visits, basically. Now, getting our focus on Medicare, the big, beautiful bill actually doesn't make any changes for Medicare as we know it today. If you're on a Medicare supplement plan, you can change your plans any time of the year. That remains the same. They are still subject to underwriting, and then underwriting means they're either going to accept you or they're going to say, no, we're sorry, we're not going to take you on, basically. There is one change to Medicare for 2026. It's not part of the big, beautiful bill, but for the first time, a limited number of procedures will be subject to prior authorization. This is a test program, a test pilot program. I've seen the list of the procedures that are affected. It's only affecting 7 states, lucky us. Yeah, right. Anyway, it's only affecting 7 states, and I've seen that list, and it's not a very large list. It's relatively small, and it's rather obscure procedures, basically. And once again, it's not that you can't have them, they just won't be, they'll be subject to prior approval. In other words, somebody is gonna look over your doctor's shoulder and say, yes, you can go forward, or no, you can't, and we're not covering it. Now, when you're on a Medicare supplement, remember this, if Medicare doesn't cover it, then your Medicare supplement won't cover it, so keep that in mind here. And we'll see how that evolves. It's a pilot program, it's not necessarily gonna be affected into law. Of course, you can change your prescription drug plan during the October 15 through December 7th time period, as you do every year, nothing new about that. If you're on Medicare Advantage, you will still have the opportunity to change plans for next year, starting to enroll in the new plans October 15th and running through December 15th. Again, those changes have been, they've been around, those opportunities to change have been standard for just about the last 20 years. If you're gonna change your plan, who are you gonna call?
You're gonna call Howard.
Right, just call Howard.
Just call Howard at 602-909-8433.
Now, if you don't have a broker, and I'm not asking to take you away from your present broker. If they're doing good work for you, stay with them. Your broker should be your good friend. There's been some advertising in the financial service industry where brokers even get invited to the weddings of their clients' children, basically. So keep a good broker. But if your broker has left, or your broker has gone away, just disappeared, and a lot of them do, especially telebrokers. If you have that kind of a broker, go ahead and give me a call, 602-909-8433. Just so you know a little bit more about me, I've been enrolling people on Medicare since 1998. I'm on Medicare myself. Do I know it all? No. Every day I learn something new about Medicare. But I know it from the inside out. I'm licensed and certified. I'm not a telemarketer who turns you over to a telebroker. I work with and advocate for you, not the insurance company. But the insurance company pays me for enrolling you. If you need or want to interview a local broker, see if they're qualified, see if they're going to do right by you, get my white paper on interviewing and qualifying a broker.
Just call Howard at 602-909-8433. He would love you to interview him. He knows that once you interview him, you're going to love him.
Absolutely, that's generally what happens. Hey, some people say, does the BBB have any good news? Well, the answer to that is you betcha. First of all, in the taxes area. In the taxes area, the standard deduction for all filers is being increased from $15,000 to $15,750. So that is for all filers. There's another benefit that came out as part of the BBB, and that is a new deductible for people over the age of 65. If you're over the age of 65, there's an additional deduction of up to $6,000 per person filing either standard or itemized, and that applies to married filing jointly or filing individually. The amount of that $6,000 deductible that you'll get depends on your modified adjusted gross income. So check in with your tax preparer. If you do your own tax filing, be sure your software is up to date. Some people have asked me about what about taxes on Social Security? The no tax on Social Security died. It never made it into law. Good campaign rhetoric, but it died on the cutting room floor.
Mm-hmm.
So be aware of that. Unfortunately, let's face it, we like all the deductions we can get. After our break coming up here pretty soon, Carol, we're going to shift the discussion, okay? And I wanted to move that towards care beyond Medicare.
So important, and you've talked about this, periodically, and I want people to understand that when you talk to Howard, first of all, what he is all about helping and assisting you and having you understand everything that you do. I love the way Howard works. He's incredibly meticulous. Just call Howard at 602-909-8433. Folks, this is a free service to you. And when you work with Howard, you're absolutely gonna love him. And again, if you have a broker that is already, working with you and he's there, fine. But if I never even heard of a telebroker, and now
That's the 800 calls you get when you get these 800 calls, or you see advertising on TV.
please do not work with somebody like that. Use somebody local and just call Howard. Again, his phone number is 602-909-8433. Howard has been doing this since 1998. Does he know it all? He says no, but I think he knows a lot more than he's willing to admit.
Well, you're very kind, but I won't say what kind.
No, I'm telling you, I know Howard, I know what he's done, I know when people have questions and how he answers them, so that you understand it. He will not let you go unless you know that you understand exactly what your question was about. Again, just call Howard. His number is 602-909-8433. Hang tight, we're gonna be back in just a minute. You doing okay?
Absolutely.
Good.
Doing great.
Good. So we're here, and I'm just letting you play. I'm just letting you do it.
Yeah, play in the sandbox, play in the
That's okay.
sandbox.
And that's good. We're still live on Facebook if you want to talk a little bit more about me.
No, I'll be soft, Dave's wrist. No, this is, I think you see what I'm talking about. There's just so much that I want to get in, and I want to get every nickel's worth of value out of it, basically.
Okay.
Hope as many, engage as many people.
Yes, I understand that, and I like the way that you're doing it, and I think it's okay also to repeat. Sometimes when you're only coming on once a month, it's okay to repeat once in a while, even if you change a little tiny
Oh, I
bit.
understand that. This could become very standard, yes.
Very much so, and I love what you're talking about, and I just do. So, how to ask, when you said that you saw the list of all the people, of the different things that you're gonna have to have pre-approved,
Yeah.
like what was
So
it?
actually, I don't remember very well, but it was so, a lot of it seemed to be very experimental. It having to do with ablations of certain parts of the body and things like that.
But like, for instance, don't we already have to
There's
have
only
them?
7 procedures that I know.
Oh,
Yeah.
but don't we already have to have them pre-approved, like by your,
No, not when you're.
not with Advantage?
Not with supplements.
Oh, supplements.
You are free of having to get any prior approval. Your doctor says you need brain surgery, you're gonna get it, nobody's gonna,
You don't have to be-
a doctor calls the shots.
That's why this was just boom,
Right,
okay.
yeah. On my brother's case, he's on an Advantage case, and his wasn't boom, his was really partial. And now he had the surgery, now he, can't bend down, pick up a piece of paper off the floor.
Cause he didn't listen to you.
No, well, he's smarter than me. He ran away from what I was telling him to do. But he did it very on the slide.
Yeah, but that's,
Yeah, hey,
this is what you do.
If he didn't break his hip, he would have been a winner. He could put all the money up saved, okay?
Very interesting. I love it. I like the way you engage with the audience. So welcome back, everyone. I love the way Howard is doing this. I'm going to let him take the mic.
Well, thank you again, and welcome back. Great to be here, having a good time, enjoying myself very much. We've discussed, let's shift the conversation. Let's talk about care beyond Medicare. And what do you mean by care beyond Medicare? Well, Medicare does not cover custodial care. And as we age or as we're injured, sometimes we need a period, and maybe a long period, of custodial care, basically. So this is what I mean when I talk about care beyond Medicare. You might care long-term care. There are long-term solutions to finance care beyond Medicare. I'm not talking about traditional long-term care policies. You may have looked at those and passed on taking one of those, or because of a poor health history, were denied having this coverage. But there are policies out there now, policies that have been developed over the last 10 years that have easier underwriting and greater flexibility, and might be the solution you're looking for. Let me give you an example. Say you put away $100,000 for your long-term care needs, should the occasion arise. it's easy, it's safely set aside for your, in your right pocket. If the need arises, you have that $100,000. If the need never arises, the money passes to your family. On the other hand, depending on the plan you select, you figuratively move the money from your right pocket to the left one, and when required for long-term care, it can be triggered to provide $200,000 to up to $300,000 of long-term care at home, in an assisted living facility, or in a skilled nursing facility. If you never touch it, you never need it, it passes at $100,000 with accumulated growth to your family, basically. So how do you get more information on such a plan? Give
Just
me a
call Howard.
Yes.
That number is 602-909-8433.
Right, so I'm doing quite a bit of speaking in various venues with these kind of policies. And it's getting the excitement, the attention of people who were denied coverage previously, gives them a chance to take a look at. They made provision for themselves. Another kind of policy that I've worked with is I'll call it a short-term, long-term care policy. And a short-term, long-term care policy is only good for 1 year. But the old saying, something is better than nothing, is very important. Now, why do you get this kind of coverage? You get this kind of coverage for two reasons. Number one, you may be all alone. There may not be any family support, and you need support. You don't want to go on Access. I just told you earlier that Access is having its own problems. Medicaid's been cut, and the biggest users of Medicaid funds happen to be senior citizens. Through in Arizona, we call it the Altex program. Arizona Long-Term Care Solutions, I think, is the acronym. So you want to make sure that you're not put into a place that is substandard. I'm not going to say that every facility out there that is Altex is substandard, but it's not as good as private pay. There's not the extra care that goes into private pay. So if you're looking for a year is better than nothing. Now, there's also a second reason why you buy a long-term care policy, even a short-term long-term care policy. You don't want to be a burden to your children. What does that mean? Well, you can either be a financial burden, maybe your daughter has to stop working, or maybe your grandson can't go to college because you need the money in order to provide additional care for your senior loved one. Those are just some of the things that people don't want to be a burden, a financial burden. But then on the other hand, if you don't have the money to shift, to move around, take from the college tuition, stop working as many hours, drop out of the workforce to take care of your aging parent, if you have to provide that care yourself. I mean, can a 95-pound, 120-pound woman take care of her 250-pound father? Can she feed him? Can she walk him to the restroom? Can she be sure his shower is given? All these other kind of things. The answer is no. So you don't want to be a burden to your children. You love your children very dearly. They love you dearly too, and they would do those tasks for you. I've seen that time and time again where that has happened. But let's try to avoid it. And there are now additional opportunities for avoiding these tremendously troubling situations. So let's jump off of healthcare. Let's turn to something a little bit more important. It's another aspect of my agency, and that we have an affiliation with a Wealth Wave program, which is geared to increase financial intelligence and build and protect wealth. Okay, you have to know what you're doing. I'm speaking now to the younger part of the audience. I've walked into homes in very elaborate neighborhoods, very nice neighborhoods, with very huge and well, yeah, I wouldn't mind having one of those cars myself.
Mm-hmm.
But on the other hand, they're all show and no go. And what do I mean by that? You got to have go. You got to have finances. You got to have a understanding of how to provide for yourself for later on in life. You have to understand the aspects of retirement. You have to understand the cost of retirement. And remember, the social safety nets are not what they used to be, basically. If you think you're going to retire on Social Security, you're probably looking at about 40% of your last income. I'm speaking globally. Everybody is different. I can't say that for everybody, but I believe we need to improve our financial intelligence and understand how money works. And towards that end, I have a book which I'm offering. It is called How Money Works. call me. What's that number, Carol?
602-909-8433. How money works. So let's talk about that for a second. Go ahead.
Sure, well, how money works starts with the basics. Nobody likes to hear about budgeting, so we don't spend a lot of time on budgeting, but we do make it a strong point, basically. Budgeting is important, budgeting is the plan. You gotta have a plan. If you don't have a plan, all you have is an idea. And ideas are great, but they don't become reality until you have a plan. So that's an important part of our financial intelligence program, going towards building and protecting wealth. We tell you the steps. We have 7 steps in that program. Can't articulate them all at the present time, but the first plan, that I basically make my life and my agency service is the first level, basically, which is to plan and be sure that you have a base, your base being a protective base, basically. And after that, you get into investments and things of that nature. I work with strategic partners who carry on to investments and how to really save for retirement, basically. So that's my program, that's my agency, that's what we do for a living.
Well, you know, you do so much, really, and yet it's all a free service to the families out there, because that's what you do, you protect them.
Protection is the most important thing that we can do. You know, there's nothing that can ruin a very good retirement plan unless you have your basic protections in place.
Mm-hmm.
And of course, everybody knows you need an emergency fund. We go over the basics in that plan, but we also stress the importance of having a plan and making sure that you're sticking to your plan by reviewing that plan, okay? We live in a 90-day world. Take a look at it every 90 days and be sure, set some objectives. We call these rocks, okay? Set some objectives for a 90-day period and make sure your rocks are being met. If the big problems are addressed, the small problems will tend to settle into place.
Just call Howard at 602-909-8433. Howard, you have the white paper. I want you to repeat to them about the white paper, the interviewing that you have about interviewing even you, a broker.
Sure, that may sound funny when I tell you to interview a broker, but you have to understand that you're really hiring somebody to do a job for you. It may be a small job, it may be a narrow job, but on the other hand, it could turn into a lifelong relationship. And when I say interview a broker, when I'm talking about what questions do you ask him? What do you have in common? What is his simpatico with you? What's that level? How does that work? Are you guys on the same wavelength? Or to put it in musical terms, are you a B and he's a B flat? That doesn't sound good together. You have to have harmony. You have to think somewhat alike. There has to be a sharpness for you to be able to answer questions, get answers, etc. Is he that kind of a guy or gal? Those are the important kind of things for us to address when we're interviewing somebody to do what I consider to be an important job.
His phone number again is 602-909-8433. Call him and get the white paper on this interview and interview Howard, because you know what? When you call him and you work with him, you're gonna love it. Because the one thing I know about you, the most meticulous man I've ever met, and I appreciate that about you.
And if you're new to Medicare, a third offering that we make during the show is that we have a book called Medicare Made 1, 2, 3 Easy. Don't do it yourself. Get help. I told you to call a broker. Don't answer the phone. Talk to a stranger. Interview somebody, make sure that they're going to go by the book.
So whether it's the Medicare 1, 2, 3 Easy, maybe it is the white paper on interviewing a broker, or how the book that he has for how money works.
How money works.
I got it all, and you know what, folks? Let me just say something. Howard is here to protect you. That's what you need. You need the protection, and as we get older, and with this big, beautiful bill, a lot of people need to understand it. There's going to be some big changes. They don't sound small to me. They sound pretty big. Again, please call Howard. You're just going to love it when you talk to him. His phone number again is 602-909-8433. Get the white paper. Get the Medicare book, which is Medicare 1, 2, 3 Easy, or the financial book, which is How Money Works. Again, his phone number, just call Howard at 602-909-8433.
Peace out.